All right, guys, what we'll do last is we'll just wrap it up with just like a case study type of quick video. I don't feel like I did a really good job of explaining actually like how to use it, the sequencing and the progression of it. So basically we talked about two different types of BFR. We talked about the ischemic preconditioning, basically our level 1 patients that are bedridden, immediate post-op without a whole lot of swelling with terrible quad activation, for example. A patient that's had a cast or a splint on for prolonged amounts of time. Basically what you can do with the IPC, the ischemic preconditioning or the cellular swelling, however you want to say it. You can apply the tourniquet on. Hopefully you guys have seen the upper and lower extremity LOP finding videos, but basically you find the LOP, you leave the tourniquet on for up to 5 minutes, 5 minutes on, 3 minutes off. Sorry, I'll get away from this fridge, it's pretty loud. So 5 minutes on, 3 minutes off is a good way to kind of multitask with a patient. That way if you have 2 or 3 patients at a time, this will free up a little bit, but it's also really useful. One round is 5 minutes on, 3 minutes off. You can do up to 5 rounds. Really good for growth hormone production. It can actually help avoid atrophy, and it can actually promote hypertrophy with doing something as easy as like a quad set. You can also use this post-operatively with your Russian electrical stimulation techniques. So maybe if you're going to use Russian with a patient anyway, stick the BFR cuff on them, inflate the cuff to 100% of their limb occlusion pressure. So that's our level 1, our low level athletes or patients, whoever you're trying to use it for. Just an example of something that you could do with our level 2s, some of the higher level patients or athletes. So same thing, just like in the video, just like was mentioned before, for our level 2, the stuff that we're going to do dynamic movement or exercise with, you're going to inflate the cuffs to about 80% for a leg, 50% for an arm of the limb occlusion pressure. Have them do a desired exercise depending on what you're trying to work on, whether it's quad strength or rotator cuff strength, whatever you're trying to work on. And you're going to do like a priming set of 30 reps, nice and slow, good control, good form. You're going to do a priming set of 30 reps followed by 3 working sets of 15. Give them a 30-second break-ish between each set, so that way they can kind of heal up a little bit, kind of recover between sets. It does get very fatiguing for the people that haven't tried BFR. It does get very fatiguing. Just some quick examples, like I said, our level 1s are post-operative knee replacements without a lot of swelling, our post-operative ACLs with terrible quad activation. That's when you can get in there with a level 1 ischemic preconditioning cellular swelling technique. You can just put it on the quad, leave it on for 5 minutes, take it off for 3. Once again, you could do it with our Russian E-stim techniques, what we usually do clinically for those type of patients. It could be anything like that, just to kind of promote that growth hormone uptake within the limb, just to kind of promote that hypertrophy and avoid atrophy. Some of the level 2s, say you have a post-op ACL that's 6 weeks that's progressing really nicely. You want to try this just to kind of give you something different tool to use in the toolbox. Say you wanted to do some quad strengthening exercises with them, so you could put the tourniquet on, inflate it to about 80% of the limb occlusion pressure that you found with the assessment. And you could have them do a weighted straight leg raise. You could have them do a sit to stand technique. You can have them do something that would be pretty easy without the tourniquets on, because like I said, with the blood occlusion, you're going to really have to activate some of those higher level motor units to complete a simple task. So you could do something as simple like a straight leg raise or a sit to stand. Once again, having them do a working set or a priming set of 30 reps followed by 3 working sets of 15. For like an arm, we use this quite a bit for like our rotator cuff patients and stuff like that. Once again, still follow the precautions and stuff like that with active movement and resistance. So say you have a rotator cuff patient that's 8 weeks post-op that's just really struggling activating that rotator cuff. You could stick the tourniquet on the brachium, inflate it up to about 50% of their LOP, and have them do like a side-lying external rotation with a small weight, or you could even use your crossover symmetry bands or whatever you want to do. Whatever muscle that you're trying to activate, whatever you're trying to get done from a functional standpoint, you can just apply that to that limb and just have them go through that. So once again, I just wanted to kind of glue up everything. We talked about the anatomy and physiology of it. We talked about how to find the limb occlusion pressure, but I just wanted to kind of shore up some loose ends there from a clinical standpoint of actually how to use and progress patients with it. If you have any other questions, I'm always available. Just give me a call and we'll kind of go from there. But good luck using this, guys. I think that you'll really like it. Like I said, if there's any type of literature that you want to see, any contraindication lists or anything that might be in the book, just let me know and I can get it faxed up to your clinic. So good luck using this in your practice, and I think you guys will really like it. So I'll see you guys later.